Thank you, everybody, for attending our first Center for Integration of Primary Care and Oral Health luncheon. We are very happy to have our HSDM Dean's Advisory Board, as well as the Initiative to Integrate Medicine and Dentistry Board as well, join us, as well as various people from other community organizations and industry. And we are also very happy to have Drs. Gottlieb, Dr. Catherine and Dr. Kevin Gottlieb with us today, as well as Jessica Turner from South Central Foundation. And our guest speaker will be Dr. Catherine Gottlieb. She is the president and CEO of South Central Foundation, and we are very glad that she was willing to come and speak to us at our luncheon today, because she's going to be teaching this afternoon in Dr. Russ Phillips' course with the Center for Primary Care. So we're very thankful for being willing to come and spend a day at Harvard telling us about the wonderful things that South Central Foundation is doing. So just wanted to tell you just a little bit about the Center for Integration of Primary Care and Oral Health. It's a HRSA-funded endeavor. The interesting thing about it is that it really is a collaborative effort. Myself and Dr. Russ Phillips and Dr. Hugh Silk are the co-PIs of the center. So it's a Harvard and UMass collaboration, as well as other institutions with Mass College of Pharmacy, Health Sciences University, and Stony Brook University as well. We're very grateful to have all these wonderful partners in terms of building this center. So just to briefly tell you, the objectives are the center. We have three main activities, and I think that our primary activity as we're moving through our years is really to conduct systems-level research on primary care training. And I'll tell you just briefly about what we're doing in year one to accomplish that. But also another main activity is to disseminate the research and the evidence and best practices that we've collected and that a lot of you in this room are actually conducting. And so being able to be a central repository of all of the wonderful things that everyone is doing. And then lastly, one of our activities is that we need to develop a community of practice. And that's the reason we're having our luncheon today, is to reach out to you to potentially be our community of practice. And we're very grateful for everyone who has attended. So really our year one focus has been on doing an environmental scan of understanding the current status of oral health integration. We're particularly looking at curriculum across the learning spectrum, medical students, dental students, residencies, and we'll also look at the end of the learner spectrum in terms of continuing education for clinicians. We're also looking at the core competencies and doing an assessment of the competencies for integration of oral health and primary care. So the last thing I wanted to just briefly mention is the community of practice, and it really is to bring together key stakeholders to promote the enhancement of primary care training. And we really hope that our collaboration with our community of practice will help us to create opportunities to organize, unite existing efforts so that we all know what we're doing, and to also share knowledge and help to develop best practices and highlight those best practices, and to help us to foster the collaborations and the connections that this work really needs. integration of primary care and oral health, integration of medicine and dentistry is really, it really does take a village in order for it to make it happen, and at all levels. And so we're very grateful for the initiative to integrate medicine and dentistry and their support with our current center. So with that, thank you so much for coming, and I am going to ask Dr. Catherine Gottlieb to come up and tell us a little bit about South Central Foundation.
Good afternoon. I have about 100 slides to represent your 150 years of celebration of your Harvard School of Dentistry. But I've learned from Dr. Eby as we've connected all the dots. He's our Vice President of Medical Services Division, runs our primary care division, how to quickly go through these and fly through them so that you're kind of like getting a little dizzy by the time I'm done, but I'll give you the whole picture of what we're doing with integrated care of primary care services with South Central Foundation. So first of all, I want to invite all of you, come to Alaska, come in June. We have a conference, you have an excuse. It's the week of solstice, and we actually share what we're doing globally across the world for a redesign of primary care services in Alaska. So we serve 71,000. This slide is outdated. We have 65,000 here. But it's 71,000 Alaska Native American Indians through our primary care system. People keep moving into our region. And let you see what I'm talking about. I know these are going to be hard to see, but the map shows Alaska stretching from one end of the U.S. to the other, and that's that bottom half. We cover 126,000 square miles of geographical area we're providing services to through our primary care system. So our dentists, our optometrists, our primary care providers fly out to these tiny communities providing services to our population in geographical areas where there's populations of maybe 100 to 200, 400 to up to 3,000, and then into Anchorage where we have our largest population. Half of the population of Alaska lives in Anchorage. So that's about 2 of your blocks here. Maybe 1. So the whole entire population of Alaska is 625,000. Half of that population is in Anchorage. Okay, so this is another map that you cannot see, but I'm going to tell you about it. It's a map of Alaska health care system, and if anybody ever wants to know what that looks like, this is a map that you need to have. We have 13 regional health corporations. We are the largest, and then there's 12 others. We co-manage the Alaska Native Medical Center, 120-bed facility for Alaska Native American Indians, and we provide those services of primary care through our governance here in Alaska. But this slide is tasty foods. Taste our healthy traditional foods. We brought a gift. Our tradition is we bring gifts. Russ Phillips knows this all the time. He's like, oh no, you brought me a gift. It's like, wait a minute. And then he surprises us and he gives us a gift sometimes, and his bride. And so, but they're used to this. And so it's interesting that we're doing Center for Primary Care instruction and lessons with students right across the street from you here with dental, and what we're talking about here today is integration. Our gift to you is traditional salmon, and it's right over there. So when you go pick up your brochure and everything about SCF and want to know more, there's also our traditional food for you from Alaska. It's salmon. So why listen to our story? 70% of our customer owners aged 2 to 21 have had at least one dental visit within the past 3 years. Evidence generational change of reducing domestic violence, child abuse, and child neglect. 36% drop in ER, both ER visits and hospital admits. 75 to 90% percentile on many HEDIS outcomes. Employee turnover rate decreased by 15%. and 96% customer owner satisfaction, employee satisfaction, consistent over, and this is like past 15, 20 years. We are a Malcolm Baldrige recipient of 2011. We just resubmitted. Just watch. Hopefully we get it more faster than the 8 years it took us to win the first award. So, but we've been keeping that application current, and everything that we do current. We use it like the SCF Bible. It's a Malcolm Baldrige tool, keeping it constant improvement activities. We have over 1,800 requests around the global world of requests of coming to do what I'm doing with you right now, doing presentation in the community. We bring a team. We talk about redesigning primary care around the United States. Alaska Native people chose to assume responsibility. 550 federally recognized tribes in the U.S. can do the same thing. They can take the federal funds allocated through trust and treaty agreements, and a lot of people don't understand what that means. That means we paid with our lives, our land. The population, when in agreement with the federal government, have the right to take the funds that were allocated through Indian Health Service through Congress and operate and manage our own health care. We're the only state in the United States that has done that. With our 232 federally recognized tribes, we have assumed that responsibility. And if you wonder about that and why everyone has not done that, like, why don't you just take it over? Why doesn't Navajo Nation take over the responsibility when they have the right to do that and the money? It's because if you think about owning your own health care and taking on that total responsibility, putting your own people in the governance role, and then you're responsible for life and death situations in a hospital, delivery of care, it's not an easy thing to say, yes, I'm going to do it. But Alaska Native people chose to do it, and we're doing it really well. We have really great outcomes. So we took the money, we changed everything, and we now are customer owners. We're not patients. We decided we're customers. And everybody who's a provider in our system knows that. But we're not only customers, we're owners. And so we changed the words, and customer ownership. Providers couldn't say it really well. You know, some of the doctors out there going like, customer owners instead of patients. You know, I could say patients. Patient. Customer owner, well, that's a different word. I don't want to say that. But they began to change and say customer owners. And guess what happened? The outcome of that was the way we were treated is a little bit different. With the customer kind of atmosphere, customer knows what's best, right? Are you guys from Harvard? No. I'm teasing you. I'm really teasing you. I think it's fantastic that you have so many governing people in here, decision makers, because that means everything that's happening in integration, the movement that's going to happen is going to happen. You're the decision makers. You get to write the checks. You get to move it, and the integration and the ideas behind it. So it's really a great thing that you're here. But what happened with customer ownership title, and we changed that, was we began to own our own healthcare too as people. The shift that happened was not just primary care providers being in relationship with us and moving health towards better health outcomes. We as population began to choose good, healthy choices because now we own our own health, and our healthcare system. Big shift, big change. Okay, Alaska Native Medical Center, we have surgery, trauma, emergency care, school age, children, and pediatric dentistry for the entire state. Our vision and mission is a Native community that enjoys physical, mental, emotional, and spiritual wellness. It's about the whole body. Our goals are shared responsibility, commitment called family wellness. And family wellness is a family approach when we provide our world of dentistry. Our operational principles is based on relationship, and our acronym of relationships includes everything that we say we're going to allocate resources to. So it has to be relationships between customer owner if you're bringing an initiative in. You have to be able to measure it, have outcome measures. It has to be a population-based system. and also services built on the strengths of Alaska Native American Indian people. So our primary care system is like other primary care systems. We have everything that we provide, except that we have customer owners in charge and helping to make those decisions, moving it, and our system is built in relationship. So if you come and you are providing services in our primary care systems, you're going to have to be in relationship with each other as employees and/or governance, and then you're going to have to be in relationship with the customer owner. That means tell story. That means take down boundary. That means remove whatever walls you have in between you and the person you're servicing and providing services to and are working with side by side. We get to know, I have 30 grandbabies, we do, 30 grandchildren, and that we've both been in our system for 30 plus years. And we have 6 children that go along with those grandchildren, but we don't talk about them. Okay, so South Central Foundation, over 250 dental staff, 4 facilities, 75 dental operatives, dental department. We have the NUCA emergency, NUCA system of care, NUCA emergency, NUCA same day, NUCA adult exams, exam and cleaning, NUCA school exams, exam cleaning and filling, and we've improved access to pediatric specialty, adult exams, and cleaning appointments, and reduced wait times for urgent and emergency same-day dental needs. How are we integrated with primary care? All of us know our vision mission statement. All of us have to learn relationship. All of us have to be connected. One hand is not going to know what the other is. Our vision is the same. Our annual plans are the same. Strategic planning and process is the same. Budgeting is the same. Money gets put together. Third-party revenues of dental is never taken away. It's always put back into dental, but we can share it across the departments, so money can be green when it comes in the door when we're billing. Okay, so ICF dental field program we have training programs, pediatric residency, dental assistant training program. We have advanced general practice program, and also dental specialties, pediatrics, orthodontic, and endodontic, oral surgery, and what you said. What he said. Okay, so this is the new wonderful thing that's happening, integrating primary care and dental child's clinic, opening summer of 2018. I have to pause here. We have a chief financial officer, and all of you have one of those. And they are the gatekeepers for funding, and we knew an alien took over his body when we began to build this building. Because this building was only supposed to be 2 floors for a pediatric dental clinic, for a children's dental clinic. And he came in the room and said, oh, no, you need to add 3 more floors. And we said, alien took over your body. You never want us to build more than there is. And he said, this is in primary location place right next to the hospital. We need to grow whatever is needed for the pediatric, for our children. And so it grew 3 more floors. Now we're going to have integrated primary care, children's clinic in all areas of the floors, and I'm going to tell you what's going to go in there. So the first and second floor is going to be dental and orthodontics, pediatric dental, advanced general practice, and dental assistants, first and second floor. Third floor, OBGYN, so it's maternal child wellness tied and weaved in together with what's happening at OBGYN, neuropsych, and then on the 5th floor will be children's behavioral health. So they're going to, Kevin calls it forcing them all together, and they're all going to have to play well. Do you play well with primary care providers? Do all of you play well together? Yes, everybody's saying yes. Come on down. You guys can show these guys how it's supposed to be when that building gets all mushed together. But they do play well in our primary care system. I'll tell you some ways of how they do this. When we all go out into the global world, we're talking primary care globally across the world and how we go about doing it. We do want to let you know we have world-class facilities, state-of-the-art equipment. When your students get graduated, we want them to come to work for us. Christopher, you have to come back to Alaska. You didn't think I was going to talk to you. So you have a student here from Alaska, and when he's done, he needs to come home. because we have the state-of-the-art equipment for you and great facilities, and you want to do that, and we're integrating primary care together with dental. We have the state-of-the-art dental operating rooms, and we have the residency programs that we have in Alaska, and I've talked a little bit about those already. Let me keep going. So, shared mission and vision, integration of primary care dental. We have our primary care providers are learning how to do fluoride care with their patients when they show up into their primary care system. Our dentists are learning how to check for screening for diabetes. So they're starting to learn and integrate with each other. We were just having a conversation about how primary care docs, when they say, open your mouth, they say, ah, they don't know there's teeth in there. So we have to instruct primary care providers, there are teeth in your mouth, and you want to take a peek at them while you're at it, and if you can, please refer. And so they're learning now to refer to one another. It's a growing thing of integration. They are learning that both can do same-day access. Primary care was first, doing same-day access. Dental came later for doing same-day access, but they have achieved it. So fluoride varnish billing are available in primary care with our system, continuity of care, virtually no turnover in from our professionals in the dental world. Did you hear that, Christopher? No turnovers. And improves communication with all levels of primary care. So we're together. I'm going to go really quickly now through the rest of the slides, come back to questions. We have Anchorage Service Unit. I told you we have 126,000 square miles that we're serving, sending our dentists out. So for those of you who like to travel in itsy-bitsy little tiny planes to little tiny villages and visit the people that are living in the communities with your dental health aides, which we groom and train, grow up from their current communities, we take them, they're 100% Alaska Native people, dental health aides, and American Indian, who we bring in the front door, teach them how to be dental health aides, send them back out to the villages. We have portable schools set up that we can do treatment in the village. That's one of the kids. So cute. Traveling to the villages can be dangerous. It's beautiful, but we're going to take and put you on a little tiny airplane. And some of you like that adventure. That's why you became dentists, right? So seriously, there is lots of adventure. You get in a little airplane, which carries about 2,000 pounds of dental equipment sometimes, and you're wondering how can you fit in there with this equipment, but you can. And you have these little tiny sleeping quarters that are on mats that you're out in the village, and sometimes it's not set up for you. But the reason you go is because in our world, Alaska Native people have 2.5 times the rate of dental caries compared to the U.S. population. So you want to get out there, you want to treat the kids, you want to change their lives, and you want to help Stop the Pop campaign. We did a Stop the Pop campaign because people, the thing that gets off the airplanes and the boats first is the cases of pop because of the water. In my village, we had the best water ever. Did you know I'm a MacArthur genius? Did you know there's two of us from the same village? We said because we don't drink bottled water. And that's how come we became MacArthur geniuses. Don't drink bottled water, we drink the water from the village. But seriously, people don't drink a lot of water, they drink pop, and they think that's okay. And we've been doing Stop the Pop campaign saying, this is what happens to you if you're drinking pop, and this is what, if you don't replace it, you need to move and help us Stop the Pop campaign. So it's a global statewide effort, Stop the Pop campaign. On our campus, you can buy a bottle of Coke for $10 because there isn't a vending machine. We took all the vending machines out. You can't buy pop on our campus. But if you go down in my little refrigerator, I might sell you one for $10. But it's Stop the Pop campaign. We really live it and we breathe it. want kids to drink pop if we can help it. In my house, we do drink pop, but they know what they're getting into. Great kids receive treatment and then mentored to become dental assistants. We're constantly look for those next dentists out into our community because we believe in grooming and training our own, growing them up. That's what they did with me. Groomed and trained me, grown me up. What are the challenges? Trying to get medical and dental electronic records to talk to each other. They're not able to talk to each other right now. Medical and dental electronic records that we have. We are working on it. We're in the process of developing it because we want to improve the communication between our providers by having joint medical records. That's a big deal. These are major facilities that we have right now in the Anchorage and Matsu Valley. They're beautiful. They're designed culturally appropriate. People like to come in the door. Our clinic is really famous for our dentists whistle while they work. Whistle while they work. It's smiling time. When you go in, you feel good. You're not afraid. The atmosphere feels welcoming. And I have a really special place in my heart for dentists. I married one, and I always say that to all the dentists, and then they really like me. Then I become favorite because I say that, and because if there's any questions you have for me right now, we will respond to you and recognize your dean, and he knows of our world with our dental program and how we've groomed and trained and had to fight to get our dental health aides out there into the villages, which now works on big prevention. We're looking at changing those numbers now with all the people that are involved. This is Alaska. You can come and see our bears and whales, and we have an upcoming NUCA event, and it's over there. And my last comment is thank you, Koyana. That's how we say thank you in CIPCOH language. So, all right, leave the room. So I have open questions, and if I can't answer them, I'm going to ask Kevin to pop up here with me. Okay. So as we're invited by tribes or through the Indian Health Service, we'll go and sit with them and present our NUCA system of care and or do training. So the only tribe that has actually duplicated us, I mean almost 100%, and I'm going to say it wrong, it's the Cherokee Nation in North Carolina. If I say it that way, I've got it. Yes, Eastern Band Cherokee Nation. And other tribes have come and taken pieces and parts, but other people like Scotland has taken off and is doing our NUCA system of care in their, through the National Health Service. In their rural communities, they're duplicating what we do in our rural communities. So there's bits and places where people have taken parts and pieces of us. Other questions? Everybody, right? Anybody and everybody for dental?
Yeah, anything.
For diabetes.
It's a finger stick, so it's very easy. And we just started the program, so the providers like doing it. So
every adult?
yeah, every adult who doesn't have something on their medical chart that, unless it's just been done recently. What brought this on is there's a number of customer owners, patients, that come to dental and don't go to family medicine. There's a number that come to family medicine and don't come to dental. So we thought we should both be doing some screenings and referrals to each other. And we're just collecting data now. We had to go through our own research protocol to be able to start this in the clinic. So it's about 3 months old. But we're still in this phase where everyone enjoys doing it, so there's a lot of it going on. So yeah, the family practice is doing it. We're not doing it at that point.
No.
I can give it to you for the whole practice, but not for dental. Does that help you?
The all-in spend.
So about $110 per person for primary care only. If we add specialty care and hospital care, tertiary care, That's another $210. So it's about $320 per month per person. So it's still relatively inexpensive. It's less than $4,000.
Anyone who wants to come in to receive dental care can come in, no matter what age group, no matter where they're located. We'll either bring them in if they need specialty care, or we're out there in the community. So it's within our budget to do that for the 71,000 people. Yeah, well, the number one challenge is training people to use the equipment. That's the number one challenge. You could get this state-of-the-art equipment, you get it out to the community, and then you're like having to retrain people if they're rotating through jobs. So we have community health aides, we have dental health aides, we have behavioral health aides, and they're all using telehealth, but the number one challenge is getting the education out there for people to use that. But we do tie directly into our hospital, and we're using it in high, I'm trying to say high methods, but not, I mean, we're constant using it, in constant, yeah. Whatever I'm trying to say. Kevin, you want to come up and help me with the residency? And I just want to go back to you and say, the equipment, also the cost of the equipment, that's another challenge, is getting it, purchasing the equipment for telehealth, and then getting it out into the villages, and the connections sometimes don't work because of the weather or because of the distance and the location of the remoteness of the village. So there's some ways that we're blocked with full use of telehealth. So for retention in our organization, I believe we pay people really well. And we have, as I said, if you're working for us, you have to learn how to be in relationship. And that means we are going to put you through a mandatory training of 3 days. But we're going to start with you on an interview process. So if we're interviewing you, you're coming in the door, we're going to say, can you work in teams? Are you willing to be in relationship with your customer owners and with employees that work around you? And by then you're probably saying, oh brother, what am I doing? And I'm going to enter into this place, and would I want to work here? And so if you make it through that interview process because you choose to work with us, you will go through a process where you'll learn how to share and grow and be together, and then you're going to be in relationship with your customer owner. My dentist I've known for over 15 years, and I ask for that same one all the time, and it's not him. Not him. Not talking about my husband, and same with hygienists. And she left. We have one that just left. So I'm in relationship with those people. They know who I am. They know my ups and downs, even in my life. They know when I'm having another grandbaby. That's a closeness and relationship I have with that population. And we know each other. All the dentists know each other. We have pictures of the families together. They celebrate. All kinds of events, whether you're having a baby, if you're going to a funeral, or if you're going to a wedding. We're all in relationship as a community. And so what about the residency programs?
So who runs it? Was that the question? Yeah, so they're COTA approved, and the folks running it now are graduates, and they've probably been involved with the program for a good 5-10 years. The pediatric residency is run under the NYU program. Why it's not University of Washington, I have no idea. NYU is willing to do it. The advanced general practice residency, I'm a graduate of that. That's been going on for about 45 years, and that was under the authority of Indian Health Services. One of the things that we took the management over. Does that answer?
All right. We're going to learn from you. We'll be watching you. We don't have all the answers. So as you move forward, we want to pay attention on how you're doing your integration, how people are doing it. We want to listen in here too and be part of this as you grow. So thank you for the invitation. Thank you. Yeah.